Hi, everyone, and welcome to this webinar today. My name is Ruth Wilcock, and I'm the Executive Director of the Ontario Brain Injury Association. OBIA has been educating people in the field of brain injury for close to 35 years, and we are very excited for this webinar series that we have been presenting. We have been doing this in collaboration with Brain Changes Initiative, whose founder is Dr. Matthew Galati. And Dr. Galati sustained a very serious traumatic brain injury in 2013. However, he was able to return to medical school and is now a fully licensed physician. Today, we will be hearing about Matthew's story and his journey of recovery. I want to thank the sponsor of today's webinar, which is Vox Neuro. We so appreciate you sponsoring and could not do this without you. And I'd like to invite Dr. Kyle Ryder to come and introduce Dr. Galati.
Awesome. Thank you very much, Ruth. I appreciate that introduction there. So hi, everyone. My name is Dr. Kyle Ryder. I'm the VP of Clinical and Scientific Affairs at Vox Neuro. We're very excited to be here today as the sponsor of the OBIA and Brain Changes Initiative speaking series, and hope you've enjoyed the webinars presented today. Vox Neuro, just for a little bit of info on Vox Neuro, is a health tech company that has developed an EEG-based cognitive health assessment designed to complement existing clinical protocols. Our software scores multiple core cognitive functions, which gives healthcare providers reliable neurophysiological scores of cognitive function to support proactive brain health, informed clinical decision-making, and customized care. If you're interested in learning a little bit more about Vox Neuro and our technology after this webinar, be sure to check out our website at voxneuro.com. So now to get into and introduce the man of the hour, Dr. Matthew Galati. So in 2013, Dr. Galati, a medical student at the time, suffered a severe traumatic brain injury in a motor vehicle accident. Refusing to accept ill fate, he researched how best to heal and created his own recovery protocol based on a revolutionary new science around a brain-supporting lifestyle. Against all odds, he recovered fully to complete his medical training and has come full circle as a physician. After finishing his residency training in family medicine in 2018, Dr. Galati completed a fellowship in environmental medicine, which has a strong focus on integrative medicine. As of 2019, Dr. Galati has had his own family medicine practice with the East GTA Family Health Team, and he is also a hospitalist at the Rehabilitation Hospital Runnymede Healthcare Centre. In addition to working as a physician, Dr. Galati is the clinical lead for research being carried out at Toronto Rehab Institute, which is centered around two of the pillars he is using during his own recovery, those being intensive physical and cognitive exercise. In 2019, Dr. Galati founded the non-for-profit organization Brain Changes Initiative to fund this groundbreaking research being carried out at Toronto Rehab today. So without further ado, I'd like to present to you Dr. Galati, and we're all looking forward to hearing your presentation.
Hi, everybody. I'm Dr. Matthew Galati, brain injury survivor, medical doctor, and founder of Brain Changes Initiative. I'm so excited to be with you all here today to take you on a journey through my own recovery and all of the insights that I learned. So we're going to be discussing my 5-pillar approach to recovery, from TBI survivor to medical doctor. So here are our objectives. Today, we're going to be talking about some positive predictors for traumatic brain injury recovery, the navigation journey of a patient from the acute stages of injury through to inpatient rehab, to outpatient rehab, then back to the community. And I'm going to be utilizing my own story to demonstrate this navigation pathway. We're going to be talking a little bit about neuroplasticity and the lifestyle pillars for brain health that I use to help heal my brain. And recovery from TBI is possible, and patients can achieve their dreams, goals, and aspirations. And I hope to show you that through my presentation today. So as I mentioned, I'm going to be using my own story as a narrative or a case study to demonstrate these pillars of recovery and the journey of a patient from acute care back to, independent living. So case, we have a 23-year-old medical student, which was me at the time. I was an avid athlete. I had a very strong support network, good group of friends and family. I had just finished studying for my second year medical school first semester exams. And I was back home in Toronto visiting some friends and family. And I was planning to leave on the Sunday night. But the weather conditions were so bad that I decided to leave on the Monday morning from Toronto back to my medical school, which was in Windsor, on Monday morning. So here are some pictures of me pre-injury. So as you can see, I was an avid athlete. I had a lot of hobbies. That's me playing the guitar. This is a picture and a video of my white coat ceremony. So this was my inauguration into the medical community. These are my med school friends on the left and my family on the right. A tragic Monday morning. So as I mentioned to you before, I planned to leave on the Sunday, but the weather was so bad that I was like, you know what, it's better to leave on the Monday. So Monday, January 28, 2013, I'll never forget this date. The weather was terrible. There was freezing rain. There was a sheet of ice covering the highway. The weather was so bad that there was a detour route off the 401 West at Woodstock. And it was on this detour route that I would lose control of the car, collide with a tree, hit my head, lose consciousness, and the rest is history. So here are some pictures of the car post-accident. So it was pretty rough, and they actually had to remove me from the car with the jaws of life. So just wanted to take a moment here to discuss the positive predictors for good recovery. They're both static and dynamic factors. So let's talk about some static factors here. So age in general, a younger brain is more plastic. It has more potential to change, heal, and recover. But also on that note, a brain that's too young may also be vulnerable because that brain hasn't reached certain milestones that are absolutely necessary for development. Pre-morbid intellectual abilities and education. So in general, higher pre-injury baseline, better recovery trajectory. So if you have more cognitive reserve prior to your injury, you tend to fare better. Now the dynamic factors. So socioeconomic status. If you come from a family that is of higher socioeconomic status, you are better able to afford necessary treatments and allied healthcare professionals that are vital for recovery from traumatic brain injury. Family social supports in general, the better support that you have, the better these patients do. Exercise. So we'll discuss exercise a little bit further in the coming slides, but exercise, specifically aerobic exercise, is extremely important for the brain. And in general, if you're more physically fit prior to your brain injury, you are better able to get back up to that level of intense exercise post-injury. So here are the positive predictors that I had that would indicate a good recovery. So I was relatively young. I was an avid athlete. So I was very physically fit prior to my injury. I was a medical student, so I had a very high cognitive reserve. I had a lot of great supports. So immediately post-injury. So luckily, I had a passenger with me, and my side had absorbed all of the impact. So he was actually able to get out of the car and call an ambulance. So the fire department showed up, removed me from the car with the jaws of life. EMS came, intubated me at the scene, and I was transported to the nearest hospital, which was Woodstock Hospital. Here's a list of my injuries. It's pretty extensive. So I had multiple skull fractures. I had a bleed inside my brain. I had a Glasgow Coma scale of 5. So the Glasgow Coma scale is a scale of your consciousness. It generally it ranges from 3 to 15, 3 being dead, 15 being fully conscious, and I was a 5. I had 7th cranial nerve palsy, so I damaged a nerve in my face and for months couldn't move one side of my face. It looked like I had a stroke, but luckily that nerve regrew a millimeter a day and it fully recovered. I had multiple rib fractures. I had a left scapular fracture. I collapsed both my lungs and there was question of paresis, so inability to move my extremities. So here's a picture of me in a coma, and my coma lasted 3 days, and family and friends were constantly by my side, trying to stimulate me, talk to me. So when I emerged from the coma, I was disoriented and confused. I had expressive aphasia, so I couldn't articulate the things that I wanted to say in the ways that I wanted to express them. I had poor working memory and concentration, poor executive functioning, which is your ability to plan and organize your day. I decreased speed of processing, limited mobility, and poor insight in the acute stages of my injury. Here's a list of the hospitals that I stayed at over the course of or after my injury. So as I mentioned to you before, I was originally brought to emergency at Woodstock Hospital, and this is actually a nurse at Woodstock Hospital that I visited months after recovering. I was from Woodstock transferred to the ICU at Victoria Hospital in London. I spent a week here before I was transferred to Sunnybrook Hospital in Toronto, where I was in a neuro step-down unit. And it was here that I really learned about just how severe my brain injury was. But this was also kind of where my recovery journey began, because my family was constantly bringing me material to stimulate my mind and to get me thinking again, and in hopes that it would help with my recovery. So my mom was bringing me flashcards, newspapers to read, coloring books to color inside the lines. I had to pretty much relearn everything. My older sister worked at for Natural Foods at the time, and she was bringing me some brain healthy supplements. And a friend of mine actually brought a book that became very important to my recovery because it gave me a lot of hope. And this was a book called My Stroke of Insight, which was all about the author's recovery journey after experiencing a severe stroke. And she actually returned back to a professional life. So it was through this book that I learned that recovery from something so traumatic to the brain was possible. Mind you, it took the author 7 years to fully recover. I didn't know how long it was going to take me to recover, but I knew that it was possible from this book. From Sunnybrook, I went home for a short period of time, and then I was admitted to Toronto Rehab Toronto Rehab Institute, where my inpatient rehab began. And it was here that I was enrolled in a research study with Dr. Robin Green, who is the candidate chair of traumatic brain injury. So here's some pictures of me. On the left is a picture of me at Victoria Hospital in London. On the right is the neuro step-down unit at Sunnybrook. I showed this picture to show my 7th cranial nerve palsy. So if you could see the picture on the left, it looks like I have a stroke. I can't move one side of my face. But as you could see, and this was on the left, that was about 2 months post injury. But a few months after that, the picture on the right, you could see that there still is a little bit of a facial droop or eye droop on the left, on the right side of my face, but it's much better than it was, and it kept improving. So I spent 4 weeks at Toronto Rehab, and I was working with all of the allied healthcare professionals, physiotherapy on my balance, strength, coordination, occupational therapy, and speech language pathology on my cognition and speech. And I was also enrolled in this research study under Dr. Robin Green. And this research study, what it was all about intensifying one's rehab. So I was receiving double the allied healthcare therapies that the other patients were receiving on the neuro unit in hopes of returning back to my professional school. So also as a part of this research study, I had to write a series of 4 neuropsych evaluations, which test your baseline function like memory, attention, speed of processing. And the first neuropsych I wrote was at the end of my stay at Toronto Rehab. And it was about 2 to 3 months post-accident. And I had made significant gains, but it was clear that was going to take a lot of hard work and determination to return back to a program like medicine. I just wasn't there yet. So there were some recommendations on my discharge from my inpatient allied healthcare team to my outpatient allied healthcare team around some of the things that I had to work on in order to get better. So following Toronto Rehab, as I mentioned, I was working with my outpatient allied healthcare team. And I also began to do some research on my own around the brain and what else I could do to supplement my therapies to improve my recovery. And luckily I was a medical student at the time, so I knew where to look for information. So I was delving through the literature, and I also was reading books, and there was one book that really became my Bible in the outpatient setting. And this was a book called Spark, The Revolutionary New Science of Exercise in the Brain. It was here that I learned about neuroplasticity and the brain's ability to change, adapt, heal. So the book starts by discussing a school district in the outskirts of Chicago. And there was nothing remarkable about this school district. It's not like the students in the school district were any smarter than other students in other districts. It's not like they poured more money into this particular school district, but the only thing that was different about this particular school district was that they completely revolutionized their phys ed program such that they would have their students perform rigorous exercise at the beginning of the day before their studies in order to prime their brain for learning. And the incredible thing about this whole story is that after implementing this new phys ed program, these students scored on international standardized testing, #1 in the world in science and #6 in the world in math. So I really started taking an interest in physical exercise in the brain. And you could imagine how exciting this was for me to hear. To this date, or to that date, I was under the impression that the brain was a fixed organ. From all of my medical school training, there was no discussion around the brain's ability to change, create new brain cells. So this was, this gave me some newfound hope. So I dropped the term neuroplasticity before. So again, what is neuroplasticity? What is neuroplasticity? It's the brain's ability to rewire, adapt, and change. And in mentioning neuroplasticity, I have to talk about a very important Canadian who was one of the pioneers of neuroplasticity, and that's neuropsychologist Donald Hebb. He came up with a clever catchphrase, cells that fire together, wire together. And what this phrase basically says is that every experience, thought, feeling, physical sensation stimulates thousands of neurons, forming a neural network. And when you repeat an experience over and over again with these associated thoughts, feelings, physical sensations, smells, touch, the brain triggers that same neural network every time and strengthens the synapses, which are the connections between the brain cells in that neural network. And this leads to long-term memory potentiation. This is how we actually learn a new skill, or, it's just new learning in general. And a simple way to describe this is actually the 10,000 hour rule, which basically states that if you spend a lot of time practicing the same activity over and over again, you could become an expert at that. And there's positive implications to these neuroplasticity and these neural networks. So this is what helps us learn new information, store and retrieve information in effective ways, but there's also negative implications to neuroplasticity. So if you're constantly reinforcing negative neural pathways, they become very, very hardwired and hard to reverse. So this is what happens with things like depression and anxiety, where we keep having the same negative thoughts and beliefs, and those become reinforced in our brain, and it becomes harder to snap out. So here is a illustration of cells that fire together, wire together. So we have here the postsynaptic neuron, which is the neuron that receives the signal at the synapse, which is the connection between brain cells. Here we have a presynaptic neuron. So this is the neuron that transmits a signal down its axon. So that's the long, tail. And this causes an electrical stimulation at the synapse, and then the signal is carried on down the postsynaptic neuron. So cells that fire together, wire together. So the more we practice something over and over again, more and more neurons are recruited to these synapses and these neural networks. And this, when these two presynaptic neurons fire together, it causes a larger electrical stimulation at the synapse, and a stronger signal is then carried down the postsynaptic neuron. So as I mentioned to you before, in reading the book Spark, I really started, taking an interest in aerobic exercise in the brain. So what is aerobic exercise? In general, aerobic exercise is any exercise that elevates your heart rate and breathing. And there are many different forms of aerobic exercise, including biking, running, rowing, skipping, swimming, etc. What are the effects of aerobic exercise in the brain? So aerobic exercise increases the flow of blood and oxygen to the brain. And it also raises the levels of neurohormones like dopamine, serotonin, and norepinephrine that improve your brain's ability to process information and learn. And because it increases the flow of blood to your brain, this increased flow of blood then distributes these neurohormones throughout your brain, so it improves the processing. Aerobic exercise is anti-inflammatory to the brain. It promotes positive structural changes. So it increases the thickness of very important brain regions, and it actually creates brain cells through a process called neurogenesis. And we'll discuss this a little bit further in the coming slides. So I wanted to touch on a brain region. It's actually an internal structure in the brain that is very important when it comes to the effects of aerobic exercise on the brain, and this is the hippocampus. So the hippocampus has many different functions. It's involved in the consolidation of your short-term to long-term memory. It's involved in spatial navigation and the production of brain-derived neurotrophic factor, which is essentially miracle grow for brain cells. So this is the factor that helps us with neurogenesis, which is the creation of new brain cells. So compared with healthy aging adults, there's greater hippocampal volume loss with traumatic brain injury, Alzheimer's disease, and mood disorders. But luckily, with aerobic exercise, aerobic exercise has actually been shown to increase the size of hippocampal volume. It enhances the production of brain-derived neurotrophic factor, which is the miracle grow for the brain. And this in turn improves both our memory and spatial navigation cognitive abilities. So aerobic exercise essentially is very, very neuroplastic, helps change the brain and helps us heal. So armed with this newfound knowledge about exercise in the brain, I myself began running 5 kilometers every day. And I did this to create new brain cells. And I also learned that it's not enough just to create these new brain cells. You have to fill them with meaningful information. So I would run 5 kilometers every morning. I would go home. I had some cognitive fatigue. So I would take a short nap, and then I would start my cognitive exercises for the day. And I really tried to cover all of my bases and stimulate every single area of my brain in order to give myself the best possible chance of recovery. So let's talk a little bit about cognitive exercise. In general, in the literature, there's 2 types of cognitive therapies. So there's targeted cognitive therapies. So these are specific cognitive activities that target areas of the brain that govern particular cognitive activities. So this can be important to strengthen specific weaknesses that you may have. Then there's also environmental enrichment. And this is just the general stimulation of the brain by its physical and social surroundings. So in general, a brain that's placed in a more enriching, stimulating environment has higher rates of learning. So in order to understand how I needed to heal my brain, I first had to understand the regions of the brain and the functions that they govern. So to touch on a few here, the frontal lobe is very important for our higher order cognitive functions. So problem solving, executive functioning, concentration, thinking, personality, mood. The language centers of our brain, so Broca's area and Wernicke's area, respectively. These are the speech and understanding centers of our brain. Hippocampus, we discussed the functions in the previous slides. And then we have the movement center. So the premotor and motor cortices, and cerebellum, which put simply governs our balance. So here are some activities that I did to strengthen particular areas of my brain. So to strengthen my frontal lobe, which again is responsible for our higher order cognitive functions like executive functioning, the ability to plan and organize ourselves, problem solving, working memory, which is our short-term memory, concentration. So I would create a daily schedule for myself and budget my time appropriately. As an exercise that I would do with my outpatient occupational therapist, we would plan a day to a grocery store, for example, and I would create like a grocery list, a budget for myself that I need to purchase all of these specific items that I had on my list. I would go to the store, I would organize how I was going to how I was going to visit each aisle in what order that made the most sense. And then payment was an exercise in and of itself. As a way to strengthen my working memory, so my short-term memory, I would read a chapter of a book daily, and then I would exercise my working memory by summarizing through journaling that chapter immediately after reading to see how much I had retained. Hippocampus, we already discussed the functions before. So again, this is the area that governs our consolidation of short-term to long-term memory. So similar to how I practiced my working memory, to practice my long-term memory, I would read a chapter of a book daily, and then I would reflect on that book at more distant time intervals. So 1 hour, 3 hours a day after reading to see if I was retaining that information for the long term. Wernicke's and Broca's area. So these are the language centers of our brain. So this was of particular importance to me because the area of my brain where I suffered my bleed was between Wernicke's and Broca's area. So I could understand everything people were saying to me. I could understand what I wanted to say back to them, but I had trouble putting it into words. For months and months and months, I literally had to spell out everything in my brain before articulating. I couldn't just speak spontaneously. So I would, even though it was embarrassing for me to put myself into situations where I had to talk to people because I had a lot of difficulty with this, I forced myself into social situations because this interaction was therapy for me. It was practice. I was practicing my speech skills. So for the movement centers of the brain, I was doing things like non-contact sports like golf in order to strengthen my gross motor skills. Cerebellum, which governs your posture, balance, and coordination, to strengthen this area of my brain. I was doing activities with my physiotherapist that were high-level balance activities like push-ups on a Bosu ball. And I was able to do these things because, as I mentioned to you before, I was a high-level athlete before my injury. So I already had a higher baseline. It was easier for me to get back to these things. So my cognition was improving, but it still wasn't back to baseline. But at the same time, I was battling a lot of mental health issues. So I had severe anxiety about whether I'd ever be able to return to school. You can imagine I worked my whole life to get into medical school, and everything had been interrupted by this injury. I was depressed. I had loss of purpose. Some of my friendships were changing. I felt isolated, and I had loss of independence and freedom. In addition to my mental health concerns, I also suffered severe cognitive fatigue. So after doing my cognitive activities, I would have a lot of fatigue and have to take a nap. Like, they would exhaust me. And this is a very, very common symptom with brain injury. And I had suboptimal speed of processing. So this leads me to another key pillar that I used to heal my brain. And this is mindfulness meditation, which has a ton of evidence for its ability to change the brain. And in order to understand mindfulness meditation, we have to first understand what happens when the mind wanders. So when the mind wanders and we're ruminating about the past, worrying about the future, there's certain brain regions that are activated. And these brain regions make up something called the default mode network. And when the default mode network is activated, your mind is preoccupied and rigidly fixed on, ruminating on the past, worrying about the future, and it's not focused on creating and strengthening new neural connections. So mindfulness meditation, it was always a buzz term to me, but I never really understood it. So I started looking into the literature, and I learned that it's based on Buddhist tradition, but it's also incorporated into Western medicine interventions such as dialectical behavioral therapy, which we use to help people with personality disorder and other psychiatric disorders. And what mindfulness meditation is all about, it's all about turning one's attention to the present rather than letting distractive thoughts about the past and the future occupy our mind. So in essence, this allows us to focus our mind on the present and strengthening new healthy neural circuits. So this is neuroplasticity. So mindfulness meditation is neuroplastic. It supports changing the brain. In addition to allowing us to focus on the present, mindfulness meditation also has a number of structural and functional changes in the brain. So in long-term meditators, the default mode network, as well as the amygdala, which is our emotional center of the brain, are actually downregulated. The size of our hippocampus and prefrontal cortices is actually increased and has been shown to increase in long-term meditators. And long-term meditation is also associated with increased levels of important neurohormones that improve our brain's ability to process information, as well as increased levels of brain-derived neurotrophic factor, which again is a miracle grow for the brain. So I also wanted to touch on mindfulness meditation and a symptom that I mentioned, which is very, very pervasive for traumatic brain injury patients, and this is mental fatigue. So irrespective of the severity of your traumatic brain injury, mental fatigue may persist for a long time after the initial time of your injury. And it often limits one's ability to function daily. So what are the hallmarks of mental fatigue? They are mental energy that's rapidly drained with mental activity. So even seemingly menial tasks will be exhausting for these patients. Concentration and attention are impaired over time. There's a long recovery time following overexertion, and fatigue, which is often better in the morning and worse as the day progresses. And studies have found that mindfulness-based stress reduction, which is a very specific type of mindfulness meditation, it's actually an 8-week evidence-based program, has significant improvements on mental fatigue. And it also helps with other things like processing speed, memory, attention, mood, quality of life. So I wasn't doing mindfulness-based stress reduction specifically, but I did begin practicing mindfulness meditation. And I was doing this mainly with guided meditation apps at night, like Headspace or Calm. And I also was journaling about my recovery. And this was another act which is helps us be mindful, because it allows us to focus on the present. So what were the benefits that I started noticing with mindfulness meditation? My sleep was improved. I had better energy throughout the day. My mood had improved. Mental fatigue was improving. Speed of processing was also improving. And I was better able to focus on my rehab regimen and cognitive exercises because I was more focused on the present. I also had more insight into my recovery. Through journaling, I was better able to understand my progress, areas that needed improvements. So this leads me to my next point here, and this is about sleep. And I had always been a terrible sleeper. Pre-injury, I was a night owl. I was able to function on very little sleep. And this was late at night was usually the time where I was most creative. But late nights and poor sleep are not conducive to healing brain. So I started doing some research when I was recovering around, number one, the impacts of brain injury on sleep, but also how sleep impacts cognitive recovery. And here's some of the things that I learned. So traumatic brain injury actually causes many sleep-wake disturbances. Insomnia being the most common sleep-wake disturbance following traumatic brain injury. And insomnia is basically, simply put, difficulty falling and staying asleep. Traumatic brain injury can also usually leads to increased need for sleep. And this makes complete sense because the brain is healing. So you need more time for that brain to heal, and sleep is restorative. And traumatic brain injury can also lead to excessive daytime sleepiness. And in turn, what did I learn about how sleep impacts traumatic brain injuries? So sleep in general is important to structure the brain and improve learning and memory. And again, this supports neuroplasticity. It helps the gut heal. And we'll touch on this further in the coming slides. And it's associated with a healthy immune function, which is essential for healing both the gut and the brain. It improves our mood. So as you can imagine, if you're lacking sleep, this can lead to impairments in memory, attention, alertness, problem solving, all of our cognitive skills. And if you're healing from a traumatic brain injury, those trauma-related impairments in cognition are further exacerbated. So essentially, if you're not getting adequate sleep post-injury, this can delay your healing. So I began actively focusing on my sleep hygiene, and this was crucial. So I started going to bed at a consistent time, no screen time 2 hours before bed, slept in a completely darkened room at a cooler temperature, wasn't eating foods that were very activating or stimulating before bed, so carbs and refined sugars. Wasn't exercising late at night. As I mentioned to you before, I was actually exercising early in the day. I was writing down my thoughts before bed, so that, because I did have, as I mentioned, a lot of anxiety, so I would write down my thoughts so that I wasn't perseverating about these thoughts, and I would revisit them in the morning. Practice mindfulness meditation before bed, and I also took supplements like melatonin to help reset my sleep cycle, and magnesium, which is also known to be good for sleep. Another thing that I started noticing during my recovery was that I couldn't eat the way I had previously been eating. So there were certain foods that kind of exacerbated my cognitive and mental fatigue. They led to brain fog, bloating, altered bowel movements. And this led me to think, is there a connection between the brain and the gut? And I started doing some research around this. So there is actually an intimate connection between the brain and the gastrointestinal tract. And the gut is actually has been dubbed our second brain. And the enteric nervous system, which is the gut's nervous system, is actually our second largest network of brain cells outside of the central nervous system. It's actually directly connected to the central nervous system via the longest nerve in the body, the vagus nerve. And the vagus nerve is responsible for our rest and digest response, and it's also the highway of bidirectional communication between the gut and the brain. So this is direct evidence that there is a connection between the gut and the brain. The brain also controls our stress response to emotions, memories, changes in our environments. And it does this through something called the hypothalamic pituitary adrenal axis. And basically the hypothalamus and pituitary are in our brain, and the hypothalamus tells the pituitary gland to release a hormone, which then tells the adrenal gland to release our stress hormone, which is cortisol. And cortisol then has downstream effects on all of our body organs, including the gut. And as you could see from the diagram here, it actually, cortisol leads to gut dysbiosis, so our gut doesn't function the way it's supposed to function. It actually leads to increased intestinal permeability. So the cells that line our gut, the spaces between them widen, and inflammatory particles can pass from the gut into our bloodstream. So I also want to touch on something called the microbiome. So this is an organ in and of itself in our body, and it's actually a community of microbes that lives inside our gut. And the microbiome is modulated through this gut-brain crosstalk. So this gut-brain crosstalk basically influences these microbes that live in our gut. And then these microbes in turn also further influence the gut-brain interactions. So a healthy gut microbiome is associated with healthy immunity, defense against pathogens. It's important for nutrition of the host, such as vitamin synthesis and fat storage, and also influences human behavior through this gut-brain connection. Many of you may have watched Mary's slides around brain healthy nutrition, and she talks about the microbiome. So there's a balance of healthy bacteria and unhealthy bacteria that live in our gut, and the balance is heavily influenced by the foods that we put in our body. So traumatic brain injury has a number of implications on the gut. So impairs the communication between the central nervous system and enteric nervous system through the vagus nerve. This can change the movement of our bowels, throws off the balance of our natural healthy gut bacteria, so our microbiome. And all of this in turn can lead to increased intestinal permeability. So as I mentioned to you before, inflammation within the intestine can then pass through this more permeable lining into the bloodstream. Traumatic brain injury can also lead to increased permeability of the blood-brain barrier. So inflammatory particles that are now traveling through the bloodstream can now directly impact the brain. So through all of this learning, I really started to focus on my diet, and I started to realize that in order to heal my brain, I also had to heal my gut at the same time, especially because I was having this, mental fog with certain foods that I was eating. So the way I simplify it is healing the gut and the brain through diet is essentially, there are 4 main points. So you have to promote a healthy gut microbiome. So this is eating prebiotic foods that feed the good bacteria in our gut. So things like bananas, onions, garlic, eating foods that are supportive for both the brain and the gut. So things like omega-3 rich foods, like cold water fatty fish, like salmon. Not only is omega-3 a structural component of the brain, it actually makes up 1/3 of our brain matter. It's also anti-inflammatory, it's antioxidant, it inhibits the inflammatory cascade, so it's neuroprotective, and it also is important for neurogenesis and synaptogenesis, which is the connecting of brain cells together. Eating a plant-based diet is also very, very important. And it comes as no surprise that in 2019, Canada updated their food guide, and it's now more plant-based than it's ever been in the past. And especially green leafy vegetables are important for the brain. These have been shown in the literature to be best for preventing cognitive decline, as well as colorful fruits, colorful berries like raspberries, blueberries. These have a lot of antioxidant properties. So in addition to the foods that we have to eat to support our brain, we also have to limit foods that are inflammatory to our gut and in turn to our brain. So these are things like refined sugars that feed the bad bacteria in our gut. And the last pillar that I wanted to discuss here is not one that is commonly thought about, and I have to be honest, like it wasn't something that I was necessarily cognizant of during my recovery, but I was kind of limiting my harmful exposures indirectly because my sister worked in natural foods, and she was bringing me a lot of products that foods that weren't high in pesticides. She was bringing me more natural products. So let's talk about the exposome. What is the exposome? It's the measure of all of the exposures on our body throughout our life and how these exposures relate to our health. So as you can see from the diagram here, there are a number of different exposures that we're faced with throughout our life. So things like air pollution, car exhaust, smoking, alcohol, all of these things then they build up in our body and they impact our health. And the idea is that the more of these harmful exposures that you have in your body, it's obviously not healthy, and you want to basically structure or have the best environment for the brain to heal. So there are common harmful exposures that we're all aware of that are more common sense, like the negative effects of alcohol and tobacco on the brain. And everybody kind of knows that, these are things that should be limited. But then there's also other harmful exposures that are less well known. And I just wanted to touch on an example here, pesticides. So pesticides are actually, they actually a lot of them target the nervous system of unwelcomed species. So, and many chemicals that are used in these pesticides are actually known to be neurotoxic to a human brain at high doses. However, there's very little research around the effects of chronic low dose exposure, which we would get through consuming foods that are high in pesticides. But it's likely that a vulnerable or developing brain would be especially at risk to harmful pesticides. And there's actually a number of non-industry funded independent studies which are concerning for the adverse effects of pesticide exposure on a developing brain. And in 2012, the American Academy of Pediatrics actually issued a report indicating that children have susceptibilities to potential toxicity of pesticide residue. And research was actually cited linking childhood pesticide exposure to decreased cognition, behavioral issues, and even pediatric cancers. So it's likely also that a vulnerable brain, such as one that has gone through traumatic brain injury, would also be vulnerable to pesticide exposure. Luckily, there is a very, very useful resource called the Environmental Working Group, which is a nonprofit organization which is dedicated to healthy living. Each year, the Environmental Working Group publishes a list of Dirty Dozen and Clean 15. And the Dirty Dozen are the 12 foods which are highest in potentially hazardous pesticide exposure. And the Environmental Working Group recommends you buy the Dirty Dozen foods organic. They also publish a Clean 15, which are the foods which have been shown to be lowest in pesticide residue. And they say that it's safer to buy these foods non-organic. And the American Academy of Pediatrics has actually cited the Environmental Working Group as a reliable resource for parents to consult about their pesticide use and their children. And not only does the Environmental Working Group publish this Dirty Dozen and Clean 15, but it also has a database of household products and personal products, and it provides a safety rating for these products based on scientific literature, which is an incredible resource. So this all brings me back to the case. So 6 months after my traumatic brain injury, my motor vehicle accident, and after going through my inpatient rehab, my outpatient rehab, and my extensive personal structured recovery protocol that I developed for myself, I returned to Toronto Rehab to write my second neuropsychological evaluation. And the results were impressive compared to both the brain injured population and the healthy standardized young male population of comparable age and education level. I scored in the superior range for both verbal and visual, spatial, intellectual capacity. My memory retention was similarly exceptional, and my attention, written and oral language skills were strong. And I returned back to my medical schooling within 8 months after the initial time of my injury. I completed my medical schooling successfully. My marks actually improved. I completed my family medicine residency thereafter, and then I went on to complete a fellowship focused on integrative care. And I also began traveling around the world. And I touch on these points to, one, show that yes, I did make a great recovery from traumatic brain injury and return back to a successful professional life. But also, I wanted to touch on these points to show that, yes, returning back to medical school and traveling around the world, all these things were environmental enrichment to the core. I was placing my brain in very, very stimulating, enriching environments. And in retrospect, this had a huge impact on my recovery. So what am I doing now? I'm a family physician through the East GTA Family Health Team, and we're actually in the midst of creating a brain injury clinic utilizing the allied healthcare through the family health team. And it's going to be structured around our 5 pillars of brain health. I'm a rehab hospitalist at Runnymede Healthcare. I'm involved in research at Toronto Rehab. So this is the eyepiece research, intensive physical and cognitive exercise, and the intensity of physical and cognitive exercise that can best heal moderate to severe traumatic brain injury. And this research is in collaboration with Dr. Robin Green, who is the candidate chair of traumatic brain injury. And she's also somebody that I admire a lot, and she was a huge part of my recovery. I'm the founder of Brain Changes Initiative, and it's our mission at Brain Changes to fund groundbreaking research to help improve the standard of care for traumatic brain injury. And we also strive to provide education and awareness for brain injury patients, their families, healthcare providers, and people who just want to live a brain healthy lifestyle. So we do a lot of our education through our events, such as the combined BCI OBIA speaker series that you guys are listening to right now, but also through our social media platforms. So we have a lot of great information on our Instagram. So please follow us at Brain Changes. Our website is brainchanges.org. We also have a number of community programs, and I'm excited to tell you about our Sunday Brain Gains runs, which is a weekly Sunday run through Hyde Park. And yes, it's a fun way to get people moving and exercising during this pandemic where a lot of people are sedentary, but it also serves as a way to spread awareness for the positive effects of exercise on cognition. So we're actually in preparation for our national launch, which is on June 27th, 2021, and there will be brain gains runs throughout Canada in different provinces. And we're actually having Dr. John Letty, who is the guru of the effects of aerobic exercise and on concussion, and he's going to be speaking at our opening ceremony. So please, guys, sign up. You don't want to miss it. And I continue to live a brain healthy lifestyle for a number of reasons, not because I'm trying to still heal from my traumatic brain injury, but because I think that it's just a great way of life in general. I think that it's a lifestyle that we should all adopt to thrive mentally, physically, as well as cognitively throughout our existence. So here, I include this post here to tell you a little bit about how to navigate our page at Brain Changes on Instagram. So we have a different colored brain representing all of our information posts that are for individual pillars. So the green brain represents aerobic exercise, blue brain represents cognitive exercise, wire brain is mindfulness meditation, the pink brain is brain healthy nutrition, black brain is sleep and limiting harmful exposures, and then the purple brain is navigation. You may have noticed that there were different colors of brains throughout my slides, depending on which pillar we were touching on. So in summary, thanks for listening to my presentation today. We talked a little bit about neuroplasticity, which is the brain's ability to change. repeating experiences over and over again, cells that fire together, wire together, strengthens connections in the brain. Aerobic exercise creates new brain cells. Cognitive exercise fills new brain cells with meaningful information. Mindfulness allows us to focus on the present and help support new healthy neural pathways. The gut and the brain are intimately connected. Foods that we put into our body can either be inflammatory or anti-inflammatory. Sleep is healing to both the gut and the brain, and it's important to help our brain restructure, which is neuroplasticity. Limiting harmful exposures is something that we should all be cognizant of for our brain health, and we should all adopt a brain healthy lifestyle. So once again, thanks for listening, and I will open this up to questions.
Hi, everyone. Thank you so much for joining us. I am going to bring Matthew up here. For anybody who doesn't know me, I am Lauren Huff. I am the Assistant to the Executive Director in Community Outreach for the Ontario Brain Injury Association. And we have Matt here as well to answer a few questions for us. Thank you so much, Matt, for that talk. It was amazing. It was really informative, and it's still so amazing to hear your story. So I will get right to questions because we are short on time, so we are only going to be able to answer a couple of them.
Before we get to the questions, I did see a question from Shelly Gardner, who was my SLP during my recovery. And her question was, how did my outpatient rehab team help with my recovery? And they were a huge part, and they actually helped me structure my this protocol that I presented to you guys today. So they are. It was not. I'm not trying to downgrade any of my therapies. The outpatient team was extremely important and helped facilitate.
Amazing, thank you. So first question is, what if you're limited to doing exercise? For example, you experience dizziness.
Yeah, so that's a great question. I would just say you do what you can. There's a lot of evidence in, there's, the Buffalo Concussion Test by John Letty, and that's specifically for mild TBI, so concussion. And it's based on a symptom threshold. There's not a whole lot of information out there for moderate to severe brain injury. Luckily, oddly, there's less symptoms like dizziness and headaches with moderate to severe brain injury. It has less of that symptom profile. So there's theoretically, there's a higher threshold for exercise, like you're better able to perform exercise. But again, that's why kind of the reason why we're doing the research at Toronto Rehab around exercise and moderate to severe brain injury.
Perfect. Thank you. Next, how did you find the motivation that you needed to heal?
That's another great question. So yeah, you kind of have to find the motivation within yourself. Luckily, I had a very supportive family, and I was always looking into literature for myself around how best to heal. And I had a great outpatient allied healthcare team that motivated me. But I think what it comes down to for me, it was like I had hit rock bottom, and I'd worked my whole life towards a goal of becoming a doctor. And in an instant, it was all taken away. So I guess I thought to myself, why not give myself the best possible chance of recovery possible?
Perfect. Thank you so much. Okay. What are your thoughts on other activities such as cycling to attain the necessary aerobic exercise to heal the brain?
So I don't think it matters the mode of activity. I think as long as you're getting up to an aerobic threshold, you are theoretically, that activity is neuroplastic. So that's, it doesn't just have to be running. It could be biking, it could be swimming. And I saw that question in the comments, and they were asking if I had any thoughts around, is it safer maybe to bike versus run? I'm not 100% sure the answer to that. I guess there's less pounding and stuff with cycling versus running. So there's less jostling of your brain back and forth. But again, I don't know the answer to that. But cycling is a very good activity to do for the brain as well. Again, as long as you're achieving an aerobic threshold.
Great. Okay, one more question that we have here. Is there a time you recommend limiting harmful exposures after brain injury?
Yeah, so I saw that question in the chat too. And I think it was specific to alcohol. I really this is, like I mentioned in my presentation, this is really a lifestyle change. It extends beyond healing the acute injury. We should really limit our harmful exposures as long as possible. Everybody should, whether you have a brain injury or not. Especially things like alcohol is very, very damaging to the brain. You know, I have I stopped drinking completely for 2 years after my the initial time my injury. But even now, I limit greatly the amount of alcohol that I drink, and it's probably best not to drink at all, to be honest with you.
That makes sense, 100%. Well, I think that's all the time we have for questions, but thank you so much again for sharing your story. It's been amazing for us to partner with Brain Changes Initiative on this educational series. I'm now going to pass it back to Ruth. But before we go, is there any final moments that you wanted to say, Matt?
So thank you to OBIA. We're so honored to have brought the speaker series to the public and to all the healthcare providers out there. You guys are doing amazing work. And I'd also love to thank Vox Neuro for sponsoring this talk today.
Thank you so much, Dr. Galati. That was a wonderful presentation. You are a great speaker, and I know that you are able to take some very complicated information, and when you combine that with your personal journey, I think it really makes it understandable and resonates with people. Your journey has been amazing, and your recovery has been amazing, and so thank you again. I also want to thank Vox Neuro, our sponsor for this webinar. Again, we couldn't do it without you.